Welcome back, learners. This time, I'd like to expound more on a topic that we covered on our session 1 NCLEX quick fix. And this pertains to the lobes of the brain. If you'll be asking me, why do we even have to study the lobes of the brain? Well, it's actually very important that you know in which specific part of the brain are your functions emanating from, okay? So let's move through it. Some of you might be doing the basic way of studying this by just memorizing and saying the frontal lobe. You have the Broca's motor speech area responsible for speech and language, motor functions and movements, control of morals, emotions, judgment, personality, concentration, problem solving, impulse control, reasoning, planning. I'd like to highlight the 3 essential functions of your frontal lobe. You have the 3 P's: personality here, problem solving, and planning. So don't forget your 3 P's for the frontal lobe. For the parietal lobe, okay, so you have SPOR, sensation of touch, temperature, pressure, and taste, pain interpretation, orientation as to space, and we term that spatial orientation, reading, and arithmetic, okay? For the temporal lobe, you have the auditory center for hearing, memory, that's why you always say, let me think about it, okay? Perception and recognition, and of course your language, Wernicke's language area, which is responsible for the processing of information for you to understand messages, okay? Now, the occipital lobe is responsible for visual processing. Okay, let's move on. Now, the most important thing that you have to remember when you are studying the different parts of the brain is to associate it with our daily functions. And one of our daily functions would be actually to communicate with others, such that when there's an impairment in the brain, that specific function gets impaired too. So what potentially results, you have expressive aphasia, or this refers to the inability to find the right words to say or to write. So when you say expressive aphasia, it's inability to write or say the appropriate words. And receptive aphasia could be inability to process or to understand words, okay? Now, expressive aphasia is due to an impairment in the frontal lobe or the Broca's motor speech area. Therefore, your intervention is to assist the patient to communicate. They may not find the right words to say or communicate what they need, so you have to give them picture boards. And you can have like sets of these communication aids downloaded on the iPad, and they just show it to you if they need a glass of water, they show it to you if they need a cup of coffee. And then you may want to use close-ended questions when you're talking to them so that they're not be forced to say a word. You can just actually nod their head to say yes and to shake it to say no. But some cultural differences, our friends in India would usually shake their heads from side to side to say yes. That's transcultural considerations, okay? Let's move on. If the patient is having receptive aphasia, this actually reflects an impairment on the temporal lobe, where your Wernicke's language area is. That's the area where informations are processed so that you'll be able to understand it. Now, if the problem would be receptive aphasia, talk to the patient slowly. Give them time to digest what you're saying. Don't try to finish off the sentences for the patient. So give the patient time to speak. Do not finish the sentences for the patient, and you may use gestures and facial expressions to communicate with the patient. So in both instances, whether you have expressive aphasia or receptive aphasia, the priority would definitely be communication, okay? So let's try using the knowledge we just learned to answer a sample question. Here we go. So here's a question that I would say would be so wordy in the STEM. You have a lot of information, but look up the options. They are just 2 worded options. And when you see these type of questions, you are in for a surprise. Therefore, the key is first calm yourself, relax, take a deep breath, and begin to uncover what's the story behind the data that are being presented right in front of you. Don't treat it as a question, because if you treat this thing as a question, then you will be forced to think about what is the correct answer. But if you consider this as a story, since it's actually very wordy, then you could actually just enjoy and digest whatever information is presented. Let's get through it. So a client diagnosed with glioblastoma multiforme comes to the urgent care facility for routine laboratory works. During a conversation with the patient's healthcare provider, the patient's caregiver asks, "I noticed some changes in my patient's personality lately." That should ring you a bell. Recall that when we talk about personality, the frontal lobe is the one that is responsible for that. And then the caregiver goes on to ask, is this related to his condition? Assessment by the healthcare provider of which of the following conditions will most likely help confirm that the patient's condition has affected the lobe of the brain responsible for personality changes. This is another blind spot that is actually difficult to deconstruct or uncover if you're not familiar with the functions of the different lobes of the brain. Why? It's not telling you which lobe is affected. What it's actually giving you is the information related to the function of the specific lobe that's affected. So notice that if there is actually a noticeable manifestation of a personality that has changed, always think about the frontal lobe. Now, once you have an idea of which lobe of the brain is affected, then going through each of the options would actually become just like a walk in the park, a little easy. Double vision, this is associated with the occipital lobe, so it's not associated with the frontal lobe, okay? Spatial disorientation, option 4, is associated with the parietal lobe, so it's not associated with the frontal lobe. We're left with two things: expressive aphasia, which is actually due to the impairment of the Broca's motor speech area, and receptive aphasia is due to the impairment of the Wernicke's language area, and the Wernicke's language area is found on the temporal lobe, and the Broca's motor speech area is found on the frontal lobe. Therefore, it's found in the frontal lobe. Therefore, the correct answer is definitely expressive aphasia. And if you'll be asked what your priority would be, provide the client with communication aids, whether that's manual or technology aided. Okay, so I just hope I was able to help you out, process the information which we have just taken up. Okay, so this is your mentor Ray saying a functional concept a day keeps your NCLEX RN fears away. So I'd like to invite you, let's learn together. For more instructional videos, subscribe to my YouTube channel, Gapuz Mentors, and my Facebook page, Mentor Ray. So send in your request if you would want me to cover some future concepts in my future videos. Email me at mentor.raygapuz@gmail.com. And always remember, this instructional tool is created to enable students to develop their test-taking skills. The question or questions and answers contained in this instructional video were patterned after the official publicly accessed samples from the RN test plan of the National Council of State Boards of Nursing, or NCSBN. The discussions and rationale presented in the video are based on the lecturer's research and are meant to provide an explanation for the answers to the question or questions that is or are presented. The lecturer makes no claim, directly, implied, or otherwise, that the rationale discussed is officially endorsed by NCSBN. See you in my future videos.